Is now starting. All attendees are in listen-only mode.
Good afternoon. Today is Friday, August the 21st. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. We have several presenters for today. First, we'll hear from Bernie Simons, the Deputy Secretary for DDA. Also, we have Patricia Sestoki, Director of Programs, Rhonda Workman, Director of Federal Programs, and Abigail Gadboy, Legislative Liaison and Special Assistant. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There's one option for listening to the webinar, and that's by computer. And there are several handouts in the handout section in the panel to your right, and they can also be emailed. We will be recording the webinar and posting it on the YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those at the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and thank you. And thank you for everybody who's joined us on this webinar. I hope everybody has had a good, healthy, and beautiful couple of weeks since we have done this every other week now. And I want to thank you again for your continued support and, attending the webcast and all that you do every single day. It's extremely important. Today we're going to talk about COVID-related support, such as PPE, Meaningful Day reopening that we sent out, I believe, last Wednesday, the NORI grants that Behavioral Health and DDA and Department of Disabilities have been working with the Department of Housing and Community Development, our Appendix K, and we did a survey with providers, and now we have sent one out for participants and family survey. And then we're also going to talk about DDA's transition guidance and what we sent out for navigating PCIS2 and LTSS, and then where we are with EVV, policy stat, and you'll hear from Abigail on that, and then Rhonda on Amendment 3, etc. And so again, health and safety for everybody is everybody's concern. We are committed to ongoing transparency, stakeholder involvement, input. It's extremely important because we're all in this together, and we're going on months and months and months of this continued COVID, and people being extremely cautious and careful and using PPE and social distancing and washing our hands, etc. So as I said, last Wednesday, we shared the Meaningful Day reopening framework. And this, as you know, and as I said over and over and over again, we are in no hurry or no rush to reopen. I've heard from providers who had some concerns about reopening and want to do it very slowly. I think that's absolutely great. I think I've heard from families who said they don't know if they want their son or daughter who are living with them actually to go back out, or what decisions that those families need to make, which is one of the reasons why we're doing the survey. So again, we want to have a lot of considerations for Meaningful Day reopening framework and take into considerations everybody's effort, so that we have a lot of areas that we need to address, such as safety, capacity, equity, data, collaboration, person-centered planning, etc. So this framework has been reviewed by our director, who's an MD, who's our Director of Community Initiatives and Testing Task Force. It's been reviewed by another MD in the Public Health Division Administration, who's our state epidemiologist and the Director of Office of Infectious Disease and Outbreak. And then the third MD that reviewed this was the Director of Environmental Health Bureau. And so we've also included in that Meaningful Day some guidance that the State Directors Association and its NASDDDS So it's the National Association of State Developmental Disability Directors, and the American Academy of Developmental Medicine and Dentistry has a white paper to talk about this, and we put them in there as additional resources. So let me get to about slide 5 here, and basically I talked about this a few weeks ago, and as I mentioned earlier, behavioral health and DDA have worked with the Department of Disabilities and Department of Housing and Community Development. We had said that this was for providers and individual providers, basically, who were basically saying when this pandemic started that there was a lot of shortage of PPE, personal protective equipment, and that they did a lot of out-of-pocket expenses. So as you saw in the notice that we put out a few weeks ago, we had $10 million for the behavioral health and DDA administrations for providers to get reimbursed. People are submitting their applications, and we've got more time that we can get more money out to those who are applying. So the time frame, and then I found this out yesterday afternoon from Housing, is that they're going to extend it for us until September 1st. So that gives us a little more time for providers to submit their information and appropriately and receive funding. So this week, we did send out guidance on the interaction between PCIS2 and LTSS until we are furtherly transitioned into LTSS. And there's a link on this page if you didn't get it. And, so you can see what we had sent out. And this is basically an at-a-glance document also that says, what is the scope and the units in the billing and instructions to navigate between both systems. So again, we remain committed to having our policies reflect a person-centered, flexible system that's family-oriented and participant-oriented, so we can continue to meet the needs and our obligations to everybody that we provide supports to, and meet the obligations that we have to the Center for Medicare and Medicaid Services that we committed to in our applications that they approved. And so we've been also working on the electronic visit and verification. There was a webcast done on the 17th of August with case managers about personal supports and what does that look like. I know there's been some questions because the model that we did not have in the state was supported living. And what supported living means is that an individual can have their own lease or own their own property where they live. Under our current statute, and that was in our waiver, we had an ALU or a group home that was provider owned or provider leased. And so in order to give the credence to our commitment to people to take control of their own lives, we know that there are people who basically want to have their own apartment, etc., or their own home with roommates, etc. So we're obviously making this available. What happened is, in the interim, the only way that there was funding supported through that was through personal supports. And we know that we have people who are in personal supports who basically now should be transitioning to supported living, remembering that, you'd have to do an amendment to the person-centered plan, etc. This isn't just, we're going to move you from one service to another. Even if it's your request, you still got to go through the process with case management. And so we're going to do that hopefully before, as soon as possible, I should say, not before, but before January 1, because it's my intention not to have people move into EVV and personal supports, and then transition from that to supported living. So hopefully I'm very clear about that. It's my intent to work with the whole system to ensure that we have the appropriate people receiving the appropriate supports that they desire. So you'll see how we're going to roll out EVV. We basically had this on the 17th of August and talked this through, and we've looked at doing the East and the West regions to roll them out on October 1. The fobs that will be used will be sent out by the part of the agency, which is basically Medicaid, that runs the EVV system, and we'll get it out to the providers and case managers so that they'll be available on those dates. And you can see that we'll do East and West, and look at that for a month, and then the South. And then obviously we need to be in full compliance by January 1, 2021. So we'll continue to have discussions, have some education, continue to do trainings, etc. As I mentioned earlier, I'm concerned about hearing from families. We heard a lot from providers when we did that survey. Now I want to hear from families. We have heard from some, but I'm going to ask the providers as to if you can work with the families that you provide supports to, since we don't have everybody's email address, that if you could get it to the families that you provide supports to their family members of. And my intent is to try and get about 1,000. I can tell you as of today, we've had about 700 responses so far, which I think is pretty good. And so obviously we want to get this completed. It's anonymous. We want your thoughts about, what you think about reopening, et cetera, et cetera. So I think we need that information so that we have a well-rounded discussion and be able to evaluate everybody's input and continue to have that discussion. And if we have questions, and people come up with some real great ideas that, maybe somebody didn't think about, that was an excellent idea, et cetera. So again, I'm asking the providers who to send this out to families that they provide supports to their relatives in their agency, since we may not have the availability of their email addresses, et cetera, or if you can get it to them any which way it is possible in how you communicate with family members, et cetera. The next slide we talk about upcoming September 13th through the 19th is Direct Support Professional Week. We've done this for years. I've had the opportunity to go out and visit some providers, some direct support professionals, to give them certificates. I don't think we're going to be doing that this year with COVID, but going out. But again, we've been working with the Missouri Department of Disabilities and us, and we will continue to do that. I'm going to ask you to take a look at the link on the bottom of this slide, because that's what would you be using for submitting categories, and it's a nomination form. So if you just take a look at that, and then again, the celebration will be probably virtual, and we'll figure out how we're going to do that in discussion with Department of Disabilities, et cetera. PPE, we've done 4 rounds so far. We are now getting into our next round that we just submitted. I believe it was on the 16th of or the 17th of this month, and I would expect that order to be in for masks, gloves, et cetera, within the next couple of weeks, delivered to the regional offices, and then we'll have the capability of working with providers, people who are self-directing, family members, micro boards, et cetera, to be able to assist in getting out the PPE to people. There has been a lot of discussion about Appendix K and the 18 days that were tied to the bed hold days for nursing homes. I can tell you that we have submitted our Appendix K to provide up to 30 days for the retainer payments. And I expect to hear very soon from CMS on where we are with that process. I think that I've seen an acknowledgement that they received the application, and so we will keep everybody updated on where we are, and then be able to take a look at what does that look like with the system in order for providers to bill beyond day 18. And so basically that's what I'm saying in this slide. It's obviously 18 days per calendar. If you attempt to put it in, the system isn't going to take it. When we get the approval from CMS, then obviously we'll adjust the system and take a look at the certifications and the attendance and where we are, so that we can reimburse for those retainer days. And so if you did submit in excess and you got error updates, and we've only heard from 4 providers on this with the IT service desk, so we need to keep an eye on this and see where we are with rejections, et cetera, as we move forward with, again, the retainer payments and PCIS2, and being able to put in, again, error updates, et cetera. As we do on these webinars, we'll give you an update on where we are with individuals who are confirmed by region, positive, negative, pending, and unfortunately a number of people have passed away in supports, as well as just direct support. So in the South region, there is 242 individuals positive, 69 negative, 7 pending, and 17 people have passed away. In the East region, there is 33 positive, 110 negative, 15 pending, and no one has passed. In the Central region, there's 217 positive, 484 negative, 30 pending, and 18 people have passed away. And in the West region, there's 33 positive, 158 negative, 4 pending, and 2 people have passed away. For direct support professionals in the South region, we've had 177 staff, direct support staff, who have tested positive, and we've had 4 people pass away. We've had 42 positive in the West region, and 1 person pass away. We have had 66 positive in the East, and 0 people have passed away. And in the Central region, we've had 228 positive, and 2 people have passed away. You'll see on the slide that we've updated this, but we're basically holding about 97% and 3% on our participants who have tested positive. It's 562, which is 3% of the total number of people in supports. And you'll see the line graph on the right-hand side basically breaks that out by region. And as you can see, that there has been an increase in 3 of the regions as we are still within this pandemic. The next slide basically shows the number of people between July 23rd and about August 20th that we've had an increase of 1 participant person pass away, unfortunately, and of the 525 people who have tested positive. So, that looks like it's about 7% of the people who have passed away of the total number of people who have tested positive. And again, this is anybody who's passing from this that touches our family and DDA of direct support, individuals, family members, et cetera, is just really heart-wrenching. So let's just continue to try and get as much as we can PPE out. As I said earlier, our orders come in. We need to be practicing social distance obviously washing our hands, using our face masks, PPEs, hand sanitizers, all of those things that are recommended by our public health administration within the Maryland Department of Health, as well as the Center for Disease Control, et cetera. And again, I can't stress enough that we need to be safe, we need to take care of each other, and we do not need to open up any type of meaningful day in any rush. There is no rush at all to do this. We're going to be in this probably for a long haul. You know, we all see this on the news. Even if there is a vaccination available, and the next question is always then, well, how fast can it get rolled out? And I mean, this is not just a very simple answer. There's a very complex problem, and a complex solution is going to take as we move forward. With that, I want to ask Abigail to pick up on policy stat. And again, thank everybody for being here and participating today.
Thank you, Deputy Secretary. As you mentioned, my name is Abigail, and I just wanted to give kind of a brief introduction to the new Policy Stat platform. Next slide, please. So Policy Stat is an online platform that DDA is going to be using to publish and share all of our policies related to the programs, services, and procedures that everyone within the DDA system will be following. So any member of the public, including participants, families, and providers, can view DDA's active policies through that website, and any updates will be automatically published on the Policy Stat website. Next slide, please. So in addition to the link that is included in this presentation and on the handouts that are attached to the webinar, we have also published the link on the main page of the DDA's website. So you'll see that yellow Policy Stat. It's actually white on the website right now, but it'll be there. As soon as you click on that link, it'll redirect you right to the Policy Stat main page. Next slide, please. So when you click that link, you'll be taken here, which is basically a filtered search of all of our policies. And we've filtered the search to kind of show only the policies we think will be most relevant to you. So that'll be policies related to DDA's administration, our programs, and fiscal and services and operations. Within this big long list of policies that will eventually fall under these areas, you can search in that search bar that's highlighted below for an individual policy. So instead of having to scroll through all of the policies, you can look directly for the one policy you want to find. Next slide, please. So from that main page, you click the link, you saw that search area, and if you just scrolled down, you didn't click on anything, this is what would pop up. It's a list of all of our currently published policies in those policy areas. They're automatically sorted by title, but you can, if you click on the that top line of the table, you could sort it by the policy area. So you could have the administrative policies on top, or you could sort it by last revised or last approved, see our latest policies on top. And to look at any of the individual policies from this page, you just simply have to click on that blue linked title. Next slide, please. So for example, this is our competitive integrated employment policy. There's a lot of information that is put into these policies, and I just kind of want to quickly walk through a few of the components of what you're going to see in a policy page. Again, we also attached a couple of handouts to this webinar that kind of go into more detail on what each section of the policy means, and links to helpful trainings and webinars that the Policy Stat developers have put together on how to navigate and use this interface. So highlights, high-level highlights are the title of the policy, so you know you're looking at the right thing. There is in the far upper right-hand corner the RL Datix button. That will link you to the Policy Stat Learning Center, where all of those webinars and trainings are held that were developed internally by the Policy Stat team. Below that, in the blue bar, there's a big search bar. So if you were in the competitive integrated employment policy, but what you really wanted to be looking at was the transportation policy, you could search for that in that blue bar with the big orange button. And if you wanted to print or save a copy of this competitive integrated employment policy, you can click on that printer friendly button there. Or within the competitive integrated employment policy, you wanted to jump to a specific section. So you are mostly interested in the standards part of this policy. On the left-hand side in the table of contents, you can click on the blue standards, and that is a direct link that will jump your page to the standards section. Next slide, please. So in a normal policy, it will have all of these sections: the applicability, implementation date, purpose, definition, the policy body, standards. Some policies will have additional sections. Not all policies may have these sections, but there's a lot of really great information included in all the policies. And then at the end of each policy, we've included direct links to references. So you can see the community pathways waiver where service definitions are housed, or links to federal regulations that are referenced within the policy, or links to related policies within the PolicyStat platform. So from competitive integrated employment, maybe you want to look at the broader meaningful day services policy. You can click on that link under related policies and it'll take you right there. We've also uploaded helpful attachments, which are generally PDF or Excel documents that'll download from your browser. And that can be things like helpful at-a-glance documents. In this case, it's a competitive integrated employment checklist. Next slide, please. So again, there is a ton of information held in PolicyStat, and we will be constantly updating it with new policies as we publish them. And if you have any problems navigating the website, please check out that at-a-glance document that is attached to the webinar. Will be emailed out after this presentation and will eventually be posted on the DDA website. There's lots of helpful tutorials in the PolicyStat Learning Center, which again is linked in the at-a-glance document and directly within the PolicyStat platform. And if you have any other additional questions about how to use PolicyStat, or you have a specific question related to content of a policy, feel free to email those to me at that email address there. I just want to note that the number 1 in the email address is very important. So thank you all. I look forward to receiving your questions.
Thank you, Abby. Next slide, please. Hi, this is Rhonda Workman. Hope you're having a great Friday, and I'm going to share some information about some of our website updates. Next slide, please. So new pages are being developed and existing pages are being revamped because we want to share information and allow a smooth navigation for stakeholders. Our websites have been designed and revamped to be resourceful, more user-friendly, and easier to navigate. So you're going to see that we currently have some new pages live on the DDA website. It includes a new electronic visit verification or EVV page. We've got the link to PolicyStat that Abby just shared. We've also added a new DDA Medicaid waiver programs page. We also have been revamping our family supports waiver page, the community supports waiver page, the community pathways waiver page, and also the transformation page. Next slide, please. So for the EVV page, you're going to see we're going to be adding more information to it, such as the EVV at-a-glance document, information related to the implementation timeline that Bernie shared earlier in the presentation. It'll also include some letters and guidance related specifically to it, and also some at-a-glance documents related to tips from our pilot providers who are currently utilizing the EVV system. PolicyStat, as Abby just shared, will include the policies that are currently approved, and as new policies are finalized and approved, we will also send out a notice to the stakeholders to alert you that those policies have now been included into PolicyStat. The transformation page includes transition updates, so some of the recent correspondence related to the transition from PCIS2 to LTSS Maryland. We'll also be adding some additional guidance. At-a-glance documents are currently up and could be expanded on, and also the process flows related to the transition from PCIS to LTSS. Next slide, please. For the new Medicaid waiver program page, and the links included here on this page, you're going to see some general information about the waiver programs. You're also going to see links to the DDA programs at the bottom of the page, so you can go directly to the Family Supports waiver page, the Community Supports waiver page, or the Community Pathways waiver page. And also, there's a chart that demonstrates our services. We'll be updating that to make it a little bit more visually appealing, and also adding our at-a-glance links to the services, so it's a good overview for individuals and families and stakeholders to get a glimpse of what the service is about. Next slide, please. You're going to see on our new revamp of our waiver programs additional and new information. It'll include service tabs that are specific to services provided under each waiver. The DDA eligibility application process tab will link the user to a tab that's going to describe the initial application process to the Developmental Disabilities Administration, where we determine initial eligibility and determine placement on our waiting list. The next tab relates to the DDA waiver application process. This tab will give you an overview of how the waiver application process goes in terms of once a person is on the DDA waiting list and how we trigger those opportunities to apply to the DDA waiver application. The next tab will be services that will be specific to that waiver program. So when you click on this on the FSW tab, you're just going to see our support services. On the CSW tab, you're going to see Meaningful Day and support services. And then on the Community Pathways waiver service tab, you're going to see all our services, including the residential. The next tab, we're currently working on and developing, so it's not functional yet, but it's our intent to have the approved providers associated with that specific service to provide user-friendly access to explore provider options. The next tab is our federally approved application and amendments tab. This is where you can click on to actually get the entire approved waiver application. It also includes previously approved waiver applications for historical purposes. And this is where you would find a link to upcoming amendments, such as Amendment number 3 that I'll be talking about in a few minutes. And then finally, the last tab, which we're also working on, includes DDA Medicaid Waiver Program Frequently Asked Questions. We're in the process of updating some of those FAQs that we received from the Family Supports and Community Supports waiver, and we'll add additional ones as we move through this process. Next slide, please. So now I'd like to share a little bit of information about DDA's Amendment number 3 for 2020. Next slide, please. The purpose of Amendment number 3, 2020, is it's going to be able to provide us the opportunity to update language in the waiver application, to reorganize information for better understanding. We also intend to update program slots and streamline eligibility. We're reviewing our service options and looking for opportunities to enhance them. We're updating information related to the LTSS Maryland transition based on the delay due to COVID. We also will be updating our rates, units, and adding a geographical differential based on certain counties. We also recently received a request from the DD Consortium to consider their previous comments. We are also looking at comments that we've received from the technical work group and other groups as we work through the transition and transformation of DDA and the rates. This amendment does not supersede the existing Appendix K, Emergency Preparedness and Response. Rather, this amendment is to change the existing authority such that when Appendix K is no longer in effect, this amendment would apply. So if we have flexibilities under Appendix K that are not included in the amendment, those flexibilities can continue until Appendix K ends. Next slide, please. So just some of the items that we're looking at with our proposal related to eligibility. We are proposing to remove our cost cap for family supports and community supports waiver. As you may know, in order to enter these waiver programs, the total budget cap upon initial enrollment must be below a certain threshold. We propose to remove that so that individuals can enter regardless of the total cost. We also want to focus each of our waiver programs for a targeted group. In other words, the family supports waiver would be targeted to support children up to the age of 21. The community supports waiver would be targeted to support individuals 18 years of age and older. And the community pathways waiver then would be targeted to support individuals 18 years of age or older in need of our residential services. We wanted to note that all our current participants, regardless of age and services that they're receiving, will remain in their current waiver program. This new eligibility criteria would only apply to new applicants as of the effective date of the waiver amendments. Next slide, please. Some of the service updates that we're looking at includes adding remote supports as a service delivery option based on our Appendix K experiences. We've heard from a number of stakeholders how they appreciate and value the flexibility to provide services remotely, especially during this pandemic. We are also looking to consolidate our nursing services. In other words, our nurse consultation, nurse health case management, and nurse case management delegation services all under one service. We're proposing just to keep the name nurse case management and delegation services. Our stakeholders have expressed confusion and concerns as to which of the three nursing services to request. Therefore, nurse case management delegation services will be updated to include the components of the nurse consultation and the nurse health case management, which is already reflected in it. We're hoping that this will be able to provide easier understanding and identification of assessed need for services by consolidating these services. Next slide, please. In terms of LTSS Maryland's transition update, as you may be aware, our planned transition to the DDA's fee-for-service payment method was delayed due to COVID-19. This information is reflected in our approved Appendix K. So during this transition period, participants will receive a combination of new services and equivalent legacy services that we have offered through our PCIS system. This information was recently shared in the guidance that went out. Until the DDA billing and payment system is fully transitioned into the LTSS Maryland, as we've noted in our recent correspondence, we will continue to operate in the two systems, LTSS Maryland and PCIS, our Provider Consumer Information System. The person-centered plans will continue to be completed in LTSS Maryland, and services will continue to be authorized and billed through PCIS until that service is transitioned for that participant. Next slide, please. To support providers, the DDA will use two transition strategies to phase in services and providers. The first strategy would be a plan to phase in certain services before others. For instance, our personal support services, if we've talked about the transition coming up. Maybe the next services would be our residential services and then followed by our meaningful day services. A second strategy relates to transitioning services by groups of providers who are ready to fully transition all of their services billing to LTSS Maryland. This is similar to the pilot group that is using this strategy for a small group. The transitions will occur on a rolling basis through 2022 as needed. Our service phase-in dates would be coordinated with our providers, and DDA will issue communications, guidance, and assistance related to it. Next slide, please. In terms of our Appendix I and J, which includes information related to our payment methodologies and rates and units, we want to add the geographical differential for the following counties: Calvert, Charles, Frederick, Montgomery, and Prince George's counties. These counties were identified through our work with the rate study process and with input from the technical work group. We're also proposing to change all our hourly service units to 15-minute units. This will be more supportive of our stakeholders' concerns related to the ability to submit claims or bill for units up to the 15-minute unit. Changing the monthly unit is also another strategy for us related to a number of our services, including our live-in caregiver supports, support broker services, and our employment services for coworker employment supports. Currently, we have certain rates associated with them, and we'd like to move them to what we call an upper payment limit. Next slide, please. Finally, I'd like to share our next steps and where we're at. Currently, we're in the process of finalizing our proposals that will be submitted on our website for your review. Public notification in the Maryland Registry will be posted on August 28th to announce that the public input process will be beginning. Our proposals will be posted to the DDA dedicated Amendment Number 3, 2020 webpage for each of the programs on or before August 31st. The official public comment period will be held from September 1st through September 30th. As we have done in previous years, we will have information related to the dedicated email address for which you can submit your public comments. We will review input and update the proposals based on the public comments that we receive. We will also create a summary of the documents and the DDA and department's position that will be posted on the website also after our final review and submission. Medicaid will have the final review and approval of our proposal before it is submitted to CMS. We are proposing to submit it to CMS on November 1st, for which then they have a 90-day period for which they can review, ask questions, and have further dialogue. We intend to propose an effective date of January 1st for this amendment. Next slide, please. This slide includes links to the dedicated Amendment Number 3 pages for each of the waiver programs. As we finalize our proposals, as we've done in the past, we will upload track change documents for the appendices so that you can readily see what we're proposing to change. As I mentioned above, some of the changes you're going to see is related to language clarification, where we are either regrouping or reorganizing or rephrasing the information. Next slide, please.
Happy Friday, everyone, and thank you for your continued support and joining us on our Fridays, every other Friday webinar. So we have several questions in our chat box, and I'm going to try to read them, and they're in different categories. Because it's this Friday, and I'm in a great mood, I wanted to start with some positive feedback that we received. And we have one who says, please continue to improve your community of information to public and families. What you have done over the past 3 months is monumental. Congratulations. This is giving families the opportunity to not be dependent on word of mouth information in which to advocate resources. Thank you, and keep up the excellent progress. And there's another one about great job on the EVV training documents. Very, very, very helpful. So thank you for that feedback. That does help us in how we move forward. I've categorized the questions in the order that they've come in, and also by topic. Bernie, there is a couple of questions about the NORI that I'm going to read to you and see if maybe we can either have an answer or refer to them. Here's the question. We submitted our application, however, it continues to be shown as under review. When will the application be reviewed?
So that's a good question. I think initially what happened is that there was a $5 million limit on the revenue that an agency could have. We removed that and said, no, that's a little on the low side. mean, it sounds like a lot of money, and it is, but we have a lot of agencies that provide a lot of supports to a lot of people. What happened is that initially the lever was not removed. And so I think that Housing and Community Development sent out communication, and we posted it also, saying, please take your application out of the queue, and you need to start again. We have 2 staff that are working with Housing and Community Development. I did see a report the other day that there are a few hundred in the queue. And so I can check with our staff, and we can set up an update and get that out so that people would have maybe a little bit of a notion of, I submitted something. Does it take 10 days? Does it take 2 weeks? Or do they use a standard, et cetera? I'm not aware of any, but that doesn't mean that one doesn't exist. So we'll follow up with that. Good question.
And there's one more question in reference to the NORI, Bernie. It was originally stated that NORI grants would be awarded on first come, first served basis. How will this work since the deadline has been extended twice?
So it's still on a first come, first serve basis. Let me just say that. And, we're extending it because all of the money has not been applied for. So, our intent is to have the providers still have the opportunity and the ability to apply for assistance until the money runs out. So we're not at a point where, we're down to, out of the 10 million, we're down to our last $100 or whatever. We still have money available, and that's why one of the reasons why it's been extended.
Thank you, Bernie. I'm now going to move into the other section for policy stat. Abby, does the policy stat also include PCP development guidance?
Not currently. We are working on creating new policies around person-centered plans. We will be updating many policies over the coming months.
Great, thank you. And are these draft policies or adopted policies, was there an opportunity for public comment on these policies, Rhonda?
Yes, that's a great question. Absolutely. We these policies and other policies that you will be seeing in the coming months received input from a variety of groups, including our policy review team and the provider tech group.
Thank you. And where would these policies be located again in the website?
So the policy, go ahead, Abby.
Sorry, so it will be on the main page of the website. So if you log into the DDA homepage, Donna, if you would jump to slide 19, it'll be right there, front and center, that policy stat tab at the top. So it's highlighted in yellow there.
Okay, thank you. And then I'm going to move into some EVV questions that have to do with services. So Rhonda, in reference to the EVV, what as we talk about personal supports and moving into EVV, what about participants that receive 2-on-1 personal supports would need 2 staff able to log in?
So that's a great question. I believe the guidance that's coming out from the ISIS team out of our Medicaid Provider Services will address that. But yes, there is a process for clock in and clock out related to those service needs for different staff ratios.
Okay. And then there is some questions about self-direction. Self-direction participants do not have employer authority over supported living. So personal supports and supported living are not comparable supports for them. At this point, they are not able to keep the control that they want over their services. What is the plan to correct this so that self-directed participants can keep employer authority over the services or expand the personal supports definition to include 24/7 supports?
So that's a great question. And, you know, our services that we have that we're providing through the waiver programs is based on, you know, a continuum. So there's a variety of different services and models that go from the in-home and community supports, kind of drop-in supports for our personal supports, to our supported living, and then all the way up to our provider-owned and operated group homes. So based on that, those are the service models that we're currently providing and offering, but we're happy to consider through the public input process any suggestions that the public would like to make.
So speaking of public input, why weren't stakeholders invited to give input on Amendment 3?
So that's a great question. Actually, we have been receiving input on an ongoing basis from our stakeholders. DDA regularly meets with a variety of different groups, in addition to information that we receive directly via email. The official public input process related to our proposal, as I mentioned, will be September 1st through 30th. That's 30 days for which you can review information and share any additional input that you'd like to add in consideration of our proposals.
Another one about Amendment 3, are you going to provide virtual town halls so people with disabilities and other non-readers can hear about the proposed amendments? We did not include this in our time frames, but this is something that would definitely be able to accommodate and to do some virtual meetings to go over what we're proposing. And then now I'm moving back to the question box because about 25 more questions have come up. When will the LTSS rates be finalized?
So the LTSS rates will be finalized and noted in the amendment number 3. As I mentioned, that is some of the updates that we'll have. So you'll see the final rates described and indicated in our Appendix J.
Rhonda, is there any other update about the 18 days for supported employment or CDS?
At this point, as Bernie mentioned, or just a recap for everybody so we're on the same page, we have submitted a revise, or what they call an additive, to our Appendix K to CMS. The request that went in is asking to revise our Appendix K to provide one episode of 30 consecutive days for retainer payments. That would then apply to all the retainer payments noted in Appendix K. Upon their approval, then we will be able to alert the public, and then that would be available up to 30 days.
This is a waiver question, and it says, will DDA be gradually migrating participants from CPW, Community Pathways Waiver, to community supports?
No, we are not planning to migrate people from one waiver to the other. Current participants, as I noted, would remain in their current waiver program unless their needs couldn't be met.
The next one is, when comments are submitted regarding Amendment 3, who actually reads and reviews them? Usually we have a team of people that review it based on the topic and the subject. So we would have, if it's health and safety, we'll have our nurses or behavior specialists review it. There's a team that reviews it, and then it's Patricia Sestoki, Rhonda Workman, Bernard Simons, and Valerie Roddy reviews what the folks from the group are recommended and responding. We also have a person from the federal programs, Christina Hall, who reviews every comment and then catalogs it as it comes in so that we can make sure that we respond to every comment of DDA's or the department's position to that. Do you want to add anything to that, Rhonda?
No, that's exactly right. We will review them and we will summarize them because sometimes in public comment, we may get 3 comments that are very similar. They're saying the same thing. So we will summarize the input related to changes to the waiver program in a summary document and share DDA's position related to it.
Okay. I'm just going through this. There's now some more NORI questions. We submitted an application for the NORI grant, but have not received any notice. And as Bernie said, you know, the group is reviewing it, and as they review them, you'll get a notice from them. And since they've extended it, I'm sure that as they come in, you'll get some information. The next question is the webinar on EVV on the DDA website?
Yes, the webinar for EVV is on the new EVV dedicated page.
Okay. This one is for Bernie. Do DDA Day program reopening plans need to review prior to the regions seeing it or approving it to reopen?
So we're asking for each agency that provides meaningful data to submit what their reopening plan looks like. We don't have an approval process. We're not going to say yes or no or whatever. We're looking for the key elements to make sure that the application looks complete. If we read them, we'll look at them. We might have some questions. You know that in our document that we sent out on the framework, it says these are certain elements that you should take into account. They're also on the NASD document, as well as the document from the Academy of Developmental Medicine and Dentistry. And so it's really not an approval process as much as it's a completeness. I mean, basically you are operating your own agency, and we're here to give you guidance and assistance. But, you know, again, you have everybody's not for profit as a board of directors, and I trust that the executive director of the agencies are engaging with their boards and having this discussion about next steps for their agency.
Okay, thank you. Is the EVV for personal supports only for DSPs, or is it for nursing as well? Is it required?
EVV is only for personal supports. Our nursing services are not incorporated in that.
So it's more for the DSPs, right?
Yes.
Okay. And this is a statement and then a question. And it says, personal supports by your definition isn't personal care. Why will you burden DSPs with EVV?
So personal supports based on, you know, the department's review and position related to compliance with electronic visit verification under the Cures Act must comply. And so from that perspective, personal supports is incorporated into the department's EVV requirement, and we are moving forward with providing information and support for our stakeholders related to this transition, to include that dedicated webpage that we've established.
Thank you. I have 2 more minutes, so I'm going to read 2 more. One of them is, will subdirection reasonable and customary rates be updated, having been updated since 2017? Yes, the DDA is working on not only updating those rates, but also the budget sheet to support how people are using their budgets and how to make it much easier for people to be able to complete and update and submit with their person-centered plans. The last question that I'm reading is, this is a statement, I think. Oh, glad to hear about the value DDA is placing on the supported living model. When will there be details on the transition plan to supported living? That's a great question. I think that what we're looking at, as Bernie stated earlier, is we really want to make sure that people are in the appropriate service models. And so if you have folks that have expressed that they want to be in supported living because they either live in their own home or sharing their home with other folks, do they want to go into supported living? And then what does that look like? And so we have an opportunity to be able to start a service with a provider based on how our system was created. And our Deputy Secretary's vision and position is that we really want to be able to support providers into moving forward into supported living. So we're looking at what does that look like, and then make sure that you can use the current rates that we have published to move people into supported living. So our hopes to do this is it would be, we really want people to start looking at this now, as Bernie said, because if some of these people shouldn't be in personal supports and supported living, you don't want to move them into two systems at the same time or within a short period of time. So the sooner the better. That brings us to 2 o'clock. And thank you for your continued commitment and joining us, and have a blessed weekend. Thank you.